All right, welcome back to the third and final installment of, third and final installment of the respiratory system. So this should hopefully go pretty quick, and I know part 2 was rather long. So the lungs are covered by a serous membrane that is called the pleura. So in between the two layers of the serous membrane, we have a pleural cavity. The outer layer of the serous membrane would be called the parietal pleura, right? The part of the pleura, of the serous membrane that is in direct contact with the lungs would be the visceral pleura, and the pleural cavity is the space between the two, which is also filled with serous fluid. So if you remember, the lungs are inside the thoracic cavity, right? The central part of the thoracic cavity is called the mediastinum, and the lungs are on either side of that. So here is the image, perhaps a little bit easier to understand. So the lungs are sitting inside the thoracic cavity. In the middle, we have the mediastinum. The outer layer is the parietal pleura. The inner layer is the visceral pleura. So parietal, visceral, space in between is the pleural cavity. Primary muscle of ventilation is the diaphragm. So if you ever heard or experienced pleuritis, itis means inflammation. So pleuritis means inflammation of the pleura. Okay, so basic gross anatomy, the very tops of the lungs, which actually project very high in the chest. Actually, lungs come all the way up here above your clavicle, right? That's called the apex. And the inferior surface of the lungs is called the base, which is nice because in the heart, the apex was on the bottom, the base was on the top, which is very confusing. But here in the lungs, the apex is actually on the top, it's superior, and the base is inferior, which is nice. The costal surface of the lung refers to the part of the lung that is in contact with the ribs. So that would be the anterior surface, the posterior and the lateral surface are going to be in contact with your rib cage. The mediastinal surface, that's going to be the medial face of the lungs, where it's going to be on either side of your heart. So this is a pair of lateral views of the lungs. We have the apex up top. We have the base at the bottom. Now, one thing to notice, the right lung has three lobes, whereas your left lung only has 2. Now we're going to have fissures, are going to be separating the lobes. So because the left lung only has 2 lobes, it only has 1 fissure. So it has a single oblique fissure separating the superior lobe from the inferior lobe. Over here in the right lung, 3 lobes. So we need 2 fissures. So we're going to have an oblique fissure, and we're going to have a horizontal fissure, which more or less runs horizontal. So we'll have a superior, middle, and inferior lobe. So you might be saying to yourself, well, that's kind of weird. Shouldn't there be a body be a mirror image? Well, originally, a long time ago, it really was. Right? Human beings actually have a very impressive and large heart. And the reasons for that we can talk about some other time. But as our heart got larger and bigger and we had other things moving around, the left side pretty much lost one of its lobes. So the left lung is a little bit smaller than the right lung to make room for a big heart. So this little structure down here is sort of the leftover of that old middle lobe, which is now gone. And this little structure is called lingula because if you actually see it in an individual, it looks like a tongue, like lingua, lingula. It basically means sort of the tongue, because it kind of looks like a tongue hanging at the end of the superior lobe of the lung. Again, to make room for the heart, we have a couple structures. Here from the sort of anterior lateral view, we have something called the cardiac notch. So it's a little notch in the surface of the left lung to make room for the heart. Notice that that is absent on the right side. So if we turn them around and look at the medial view, this is the mediastinal surface, right? These surfaces were all costal. This is the mediastinal surface. We have a concave structure called a hilum. So we had a hilum when we looked at the kidney, and now we have another hilum here in the lung. So this concave medial surface of the lung, this area is called the hilum, where all the blood vessels and bronchi and lymphatic vessels enter, is called the root of the liver. So where pulmonary arteries, pulmonary veins, the main bronchus, and lymphatic vessels enter and leave the lung. That's called the root of the lung. Now, over here on the left side, another thing I want to point out is the structure here called the cardiac impression. Do not confuse the cardiac notch with a cardiac impression. The cardiac notch is visible more from the anterior. You cannot see the cardiac impression. It is more medial. So this big divot or dent in the lungs, which you can't see from the anterior, is the cardiac impression. Again, just another space created by having this big heart in the way. I think other than that, we've covered all these structures, so I guess we can move on. Hilum, as I talked about, that concave structure through which the root passes. So the root is going to be made up of arteries, veins, bronchi, and lymphatic vessels. So the left lung, as I mentioned, is a little bit smaller because we have the heart is going to take up some of that space. So we're going to have a cardiac impression, which is on the medial surface of the left lung. The cardiac notch is a little notch cut out of the anterior surface of the left lung. Because we've lost space, there is no middle lobe of the left lung. So you just have a superior lobe, an inferior lobe, and they're going to be separated by an oblique fissure. A little bit of leftover structure makes a funny tongue-looking thing, and that's called lingula, all on the left side of the lung, the left lung, I should say. Right lung is a little bit more simple. 3 lobes, superior, middle, and inferior. We have 2 fissures, horizontal and oblique. Now, there are about 10 segments to the right side and about 8 to 10 on the left. Do you remember back when we were looking at the bronchial tree, we had main bronchi, and then we had lobar bronchi, and we had segmental bronchi? Well, these are the segments that we're talking about. Each lobe of each lung is subdivided into different segments. Each segment of each lobe is fed by its own artery and vein and its own segmental bronchi. So it has its own source of air and blood and its own way of draining lymphatic fluids. So it's just another subdivision of the lungs. If we take a look at the picture, we can see we're going to have more segments on the right side than we do on the left side just because of the size difference. You can see the superior lobe is broken into 3 segments, 2 on the middle, 1, 2, 3, 4 on the inferior lobe. I am not going to make you memorize the segments of the lung, so that should make you feel a little bit more comfortable. I'm not going to ask you which segment is which. But I do want you to know the lung is subdivided into different segments. Each of them are fed by blood vessel, segmental bronchi, and it has its own lymphatic drainage system. And the purpose of this is it helps compartmentalize the lung. It will help prevent the spread of damage or pathology from one part of the lung to the other. So it's just like a little way of subdividing it to prevent the spread of damage or prevent the spread of infection. But I'm not going to hold you responsible for knowing that this is the posterior basal segment of the inferior left lung. I'm not going to ask you that. All right. So the last thing we have here is our ubiquitous public service announcement, just sort of showing you what can happen after a lifetime of smoking. Though I should point out that smoking isn't the only cause of this kind of damage. Certain people who live in certain parts of the world that are heavily polluted, even if they've never smoked a day in their life, if you open up their chest cavity and look at their lungs, they're going to look like this stuff down here. So it isn't just necessarily smoking that can lead to tar or other material buildup in the lungs, which can make it hard to breathe. Pollution plays a pretty significant role in that as well. So something to be aware of. So up here is nice, healthy, happy lung tissue. Notice these structures are all very thin. It's very easy to have gas exchange. This person will have an easy time breathing, no big deal. Down here, all those spaces are filled with dirt and tar, and it's going to have a much smaller surface area. You're going to have to work way harder to get the gas exchange to happen. So that's obviously not a good situation. That's actually it for the material. Section 3 is super short. One thing I just want to end with is a nice little image of the thoracic cavity, and we pretty much understand what's going on here. We have our right lung, we have our left lung. We can see a little bit of that cardiac notch here. Remember, we cannot see the cardiac impression. This, what looks like wax paper laying on top, that's the fibrous pericardium. Right there is the pulmonary trunk. Here's the ascending aorta. Here's the aortic arch. Here is brachiocephalic trunk, left common carotid, left subclavian. Right, this back here is the superior vena cava with the right and left brachiocephalic veins. This guy right there, that is the trachea. That's the windpipe. This flattened thing back here, that is the esophagus. And you can see the ribs here in the chest wall. So nice image. We can now pretty much identify all the major structures here because we've covered the heart. Now we've covered lungs. And I've at least introduced you to this as the esophagus. In the next lecture, when we start going through digestive, we'll talk about that one as well. So I leave you with this rather interesting image, and take care, and we'll see you next time.